House Health Policy Committee will come to order. Will the clerk please take attendance?
Chair Rogers.
Here.
Representatives Whitsett.
Here.
Carter.
Here.
Hadsma.
Here.
Neely.
Here.
Glanville.
Here.
Kofia.
Here.
Conlon.
Here.
Farhat.
Here.
Fitzgerald.
Here.
Miller.
Here.
Reingens.
Here.
Vanderwalt.
Present.
Filler.
Yes.
Mueller.
Here.
Van Workum.
Here.
Roth.
Here.
Schmaltz.
Here.
Thompson.
Present.
Madam Chair, you have 19 members present. You do have a quorum.
Thank you. Thank you. Representative Neely moves to approve the minutes from our meeting on March 16. Seeing no objection, the minutes are approved. Today we will be voting to report HB 4224 to repeal the unenforceable Medicaid work requirements and then hearing a presentation from the School Community Health Alliance on the intersection of public health and our school children. We have an H1 sub that is before you. You should all have one at your place that would reinstate the Healthy Michigan Plan work requirements if the legal injunction preventing their implementation was removed. Minority Vice Chair Vanderwall moves to adopt the H1 sub to HB 4224. Madam Clerk, please take the vote.
Chair Rogers.
No.
Representatives Whitsett.
No.
Carter.
No.
Hadsma.
No.
Neely.
No.
Glanville.
No.
Kofia.
No.
Conlon.
No.
Farhat.
No.
Fitzgerald.
No.
Miller.
No.
Reingens.
No.
Vanderwall.
Yes.
Filler.
Yes.
Mueller.
Yes.
Van Workum.
Yes.
Roth.
Yes.
Schmaltz.
Yes.
Thompson.
Yes.
Madam Chair, you have 7 yeas, 12 nays, 0 pass. The substitute is not adopted.
Thank you. I think we have a few cards to read in. So supporting HB 4224 is the Michigan Department of Health and Human Services, APTA Michigan, Michigan Nurses Association, and AARP of Michigan. All right. Representative Brenda Carter moves to report HB 4224 with recommendation. Madam Clerk, will please take the vote.
Chair Rogers.
Yes.
Representatives Whitsett.
Yes.
Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Kofia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller.
Yes.
Reingens.
Yes.
Vanderwall.
No.
Filler.
No.
Mueller.
No.
Van Workum.
No.
Roth.
No.
Schmaltz.
No.
Thompson.
No.
Madam Chair, you have 12 yeas, 7 nays, 0 pass. House Bill 4224 is reported with recommendation.
Thank you. We will now hear from the School Community Health Alliance of Michigan about their organization and how school-based health centers meet the healthcare needs of our students. Joining us today are Renee Topolsky, Deputy Director for the School Community Health Alliance of Michigan, and Kimberly Barron, Director of School Health Services for Grand Rapids Public Schools. Welcome, and please proceed when you are ready.
Hi, good morning, Madam Chair and members of the Health Policy Committee. As the Chairwoman mentioned, my name is Renee Topolsky. I'm the Deputy Director for the School Community Health Alliance of Michigan. With me today, I have Kim Barron. She is the Director of School Health Services for Grand Rapids Public Schools. I thought that I would just provide the committee...
Ma'am, could you just talk into the microphone?
Oh,
I'm
sorry.
having a tough time hearing you.
I
I'm
don't-
sorry about that.
Sorry, I talk fast too. I apologize. So this morning I thought I would just provide a brief overview of our organization, what child and adolescent health centers do, the services that they provide, and then turn it over to Kim, who can talk more in detail about the services within the school systems. So the School Community Health Alliance of Michigan is the state organization for child and adolescent health centers. They also can be referred to as school-based health centers. They are defined in state boilerplate, though, as child and adolescent health centers. So the two terms are synonymous. If you're not familiar with what a CAHC is, it's basically a doctor's office within school grounds. And so we have two main models of CAHCs. There is what's called the full clinical model, which provide both primary care and mental health care services to students in schools. And then we have our mental health model only. So the full clinical model, primary healthcare services are overseen by either a physician, a physician's assistant, or a nurse practitioner. And then mental health services are provided by a master's level behavioral health professional. They are ran by fiduciaries. So in Michigan, pretty evenly distributed between federally qualified health centers, hospital systems, and local health departments. So the fiduciary is actually who hires and employs the practitioners, and then they work with the school. So it's really a partnership between the health entity and the school administration. We are funded in the school aid budget, so but the program is overseen by MDHHS. So it really truly is an intersection where education and health do meet. We have two specific line items in the school aid budget. So our full clinical sites, those that provide both the primary care and mental health care services to students, those are funded in 31A subsection 7 of the school aid budget. Currently have $33 million in that line item. And then our mental health only sites, with which the department refers to as the E3 sites. So if you hear the term E3, those are those sites. Those are funded in 31N subsection 5 of the school aid budget, and we currently have $14.3 million in that line item. So we have total 117 state-funded full clinical sites throughout the state, and then 105 of the E3 sites throughout the state. In your folder, we provided you a folder today. You'll see a bunch of information. You'll see a couple of maps in there, so you can see kind of counties where we currently don't have any sort of school-based health center. You'll see the department's map in there where the clinics are actually located. We've got a snapshot which kind of reviews over just at a high level for both our full clinical sites and our mental health sites. And then you'll see some stories in there from principals and everything about the services. So before I turn it over to Kim, does anybody have any questions, or do you want me to save questions until the very end?
I think we have a couple questions
Okay,
now.
sure.
Representative Glanville?
Oh, mine could maybe wait to the end, but
Okay,
I just
sorry.
want to thank, it's okay. I just want to thank you both for being here today. I had the opportunity to tour two of these centers last week with Kim and Renee, and just absolutely amazing. Thrilled at the, the positive impact on our students that we're, helping kids stay in school because they're able to get health care on site, helping them learn to navigate, the medical world for themselves, how to advocate for themselves in that setting. So many just amazing outcomes from this project. So thank you so much. I maybe preempted like your story, but I'm excited to have you here today and hope that we can continue to support.
Thank you, Representative.
Minority Vice Chair Vanderwall.
Thank you, Madam Chair, and again, I'm going to say thank you very much for being here. And we've done a lot of work, and I actually did tour one up in Marquette, which was an opportunity that I had. Walk us through right now in the situation of staffing and what we can do to help you with the staffing shortages and what you're experiencing right now.
Yeah, thank you, Representative. And I'll probably turn part of that question over to Kim, too, since she's actually within the clinics and can kind of see the day-to-day. I will say, as a whole, from my conversations with the department, it seems as though most of our clinics are staffed. So for right now, with that being said, we did get the $25 million increase for this fiscal year. The department is currently running through those RFPs right now, so we will hopefully have about 100 new full clinical centers opening here for the next school year. But our current network of centers are pretty staffed pretty fully. So in terms, Kim, I don't know if you want to talk in terms of what you think could be done to help with the shortage. I know that there's definitely a mental health practitioner shortage in Michigan. I think probably not just Michigan, but all over, that definitely needs to be addressed. And there are several line items within the school aid budget that address mental health practitioners in schools. Some are ran through the ISDs, some are ran through the local school districts and everything. But I don't know if you have any comments as to to what you think could be done to address that shortage?
I think one of the things that we see in our school-based health centers is the competition for mental health providers. That there's such a need for mental health providers throughout the community. So we're often competing with private practice, therapy clinics in the community, and then our schools. So I think that that's something that the department has heard from us a lot, is just being able to provide competitive wages to the practitioners that are working in the schools. I think that's the first thing that comes to mind.
Thank you very much. Yeah, and I want to say that lots of conversation around how we can keep, professionals in the state of Michigan. So if there's any ideas that you have and we can share them offline, that would be greatly appreciated. Thank you.
Sure.
Representative Hadsma, did we see your hand up?
Thank you, Chair Rogers. This map that you provided us is helpful, and a lot of these counties that don't have a child and adolescent health center are rural, but there are some with small cities like Jackson, Kalamazoo, Ottawa counties. What does it take to get one of these, and how can these somewhat urban communities drive one home?
Sure, Representative. So we have really been working, the last couple of budget cycles as we've been getting additional funding to really do a lot of reaching out, especially in those counties where we don't currently have any clinical services. We have a list that we keep at our organization of schools that have reached out to us, or other entities that have, reached out to us who are interested in having a school-based health center. Anytime new funding becomes available, we contact all of that. We have, it's, over 100 schools that we have on it. We contact all of them to let them know. MDE, MDHHS will put out notices as well. And so, and really going, I've done a lot of, like last year, for example, in Allegan County, there weren't any services. So I went down to the ISD when they had their meeting. The Allegan ISD had their meeting with all of their superintendents, and I talked about school-based health centers, and I answered all of their questions, and gave them that information and everything, and they ended up applying that following round. It might have been 2 years ago now, but they ended up applying for that, the following round. And so we do try to do a lot of reach out. In terms of the department, for the RFPs, they award bonus points to the RFPs that come into counties that don't have current services. So like this current RFP, I think it was 7 extra bonus points for if you were applying for a school in one of those counties where services weren't available. So I'm sure we're going to pick up new counties. From what I could see, there were new fiduciaries, in the applications that were coming in areas where we don't have services. And so until they're fully awarded, we won't know the final numbers. But it looks like we'll definitely pick up some new fiduciaries and some new counties with this round as well.
Thank you.
Mm-hmm.
And just following up on Representative Hadsma's question, there's a local match required, right, to some degree?
Yeah, and I think, Kim, you can talk a little bit more
There's
about.
a 30% match from the local district or the fiduciary that's required, and that doesn't necessarily have to come in the form of dollars. Like for instance, in Grand Rapids Public Schools, our match comes in the form of a rent-free space for the fiduciary that we partner with.
Sure. So, for example, my own county is white. I am sad to see, and I have been advocating for us, and I think we are applying, but we had one in the past, and there was not political will to match in the past, so we lost one. So that's sometimes the whys of your question. Representative Conlon.
Thank you, Madam Chair, and thanks for being here today. Yes, similar to what my two colleagues just were talking about, 2 of the counties are in my district that are white, and it sounds like you have the reach out, and we're hoping to get to them. 2 questions. One, how does it decided who gets the behavioral health clinic and who gets the full clinic? Is that like the younger children versus adolescents? And 2, how much does it cost to kind of set up one of these clinics?
Sure, I'll answer, and then, yeah. So, to answer your first question, how it's determined where the new sites will go, it's really the fiduciaries who apply. And so what happens is they, in Grand Rapids, Cherry Health is one of our federally qualified health centers who has several school-based health centers. And so Cherry Health would take a look at all of the schools and say, okay, the program has been around for over 30 years. When it first started, it really was targeted in areas where kids, there was like a high Medicaid population. But over the past 30 years, it's obviously recognize that it doesn't really matter where you are socioeconomically, you still need access to primary care and mental health services. And so, they'll look at a lot of factors. I mean, free and reduced lunch is something they'll look at. They'll look at, where the school is in terms of, where other health services are, how far away it is, how far kids need to travel, and they'll determine with the school, okay, this seems to be the best location. There is a minimum, the department has several minimum program requirements. One is the amount of unduplicated users that come through. So for instance, our full clinical sites, it's 500, they have to see 500 unduplicated users per year. So obviously the population of the school and how many kids it will serve comes into, is one of the factors as well. And so basically the fiduciary is who applies, and there's a long application process, that they work closely with the school on. And so then basically it goes through and they get graded, and for instance, if, there's enough funding for 20 new sites, the top 20 scores, that's where the sites are awarded to. The grant, like I mentioned, it's ran through MDHHS. Correct me if I'm wrong, Kim, because I know there was just an increase, but I believe it's $250,000 for a full clinical site. So that's how much gets awarded for the full clinicals, and then it's $110,000 for the mental health only sites, the E3 sites. So that is what comes from the department. And then I don't remember, did you have, was that it? Okay, okay, sorry, thank you.
Thank you. Representative Reinkens.
Thanks, Chair. I have a couple questions. So based on what you were just saying, $250,000 for a school, well, I guess school linked is how you describe it here, a school linked site. That's only MDHHS-based grant funding. Does that site also bill health insurance to pay for the clinical services or any other services that are provided there?
Yeah, so the school-based health centers or the child and adult health centers do bill private insurance and Medicaid for reimbursement. So there is funding that comes down through those channels too to supplement.
Okay, and then the school-based health centers will also serve people who don't have insurance.
Correct. Yep. Inability to pay is never a reason to not receive services.
And it's only for people 18 or under, or is it also for family members in a
Just
community?
5 to 21 are served through the school-based health center. So, and it extends up to age 21 because that gives the providers time as students are graduating. They can meet with them, help them transition to a primary care provider in the community, see them for a little while after they graduate until they've really become established, either where they, whatever they're doing post high school, they have time to make that transition.
Mm-hmm. And then, so since you do bill insurances, the centers that are sponsored by schools and not through another clinical source, how do they do the billing since schools don't typically contract with health insurance companies?
Yeah, that for a full clinical site, that would be very challenging. So, so we're the fiduciary of the grants in Grand Rapids Public Schools, but we partner with a federally qualified health center. I don't think it would be possible for a school district to provide the services without a medical partner. For that reason, we don't employ physicians. So our mid-level providers in our health centers, so the NPs or the PAs, are overseen by a physician. So yeah, it would. I think it would be impossible to run a full clinical site without a medical provider.
Okay, thank you.
Representative Thompson.
Thank you, Madam Chair. So I know we're limited on time. Thank you so much for coming and giving us all this great information. So I have a couple questions, but I'm going to kind of try to put it all into one so that I'm not taking too much of your time. So the physicians or nurse practitioners or PAs that are seeing the children, will they be doing any type of televisits with the child? And if so, will the parent or guardian be there with the child? And then another question is the child's chart. Is the child's chart kept off school grounds, or does staff, teachers, principals have access to the child's chart?
Want me to take that?
Yeah.
So we have, so our school-based health centers are located within the school, but we partner with an FQHC to provide the services. So the Cherry Health, it happens to be our FQHC, and they have their own EHR. So there's a consent process. So students that want to be seen in the health centers, parents consent to the services. So if parents have consent, and telehealth services are available. So if they've consented to a telehealth visit, parents don't necessarily have to be present. They can be. Sometimes parents do come along to the in-person visits or are present on a telehealth visit, but if they've consented ahead of time, they may be at work or wherever they are, and the students are at school receiving those services with parents' consent. And then, the EHR is kept through, either the hospital system or the health department or the FQHC, and our school staff wouldn't have access into their EHR, their electronic health record.
They have no access to the child's health record?
No, not. If the parents consented to a collaborative meeting, and there may be some collaboration that happens with parents' consent, but similarly to me being a school employee, I wouldn't be able to access like a physician record at a doctor's office.
Okay, thank you.
Similar privacy laws.
Yeah. Thank you very much.
That, yeah.
Thank you.
Okay, and then seeing no other questions, if you wanted to continue, I didn't know if you had further presentation or.
A lot of what I was going to say has been answered in the questions, so you guys were all right on. I was just going to tell you a little bit about the services provided. So if there are more questions, but I think you've kind of captured in your questions what I was going to say about our programs.
Did you have a further presentation? Oh, Representative Kafia, sorry.
Thank you, Madam Chair, and thank you for your presentation. I was looking at the documents that you provided to us, and the one from JFM Consulting Group talks about adolescent mental health as a growing public health concern. You have stats with kids with age 6 to 17 with anxiety and or depression had increased from 5.4 in 2003 to 8.4 in 2012. And then the one that really kills me is children affected by poverty. The rate nearly triples to 22%. That's in 2012. Do you have anything more recent? Because we're now 10 plus years later. Do we know? I'm afraid those stats probably haven't gone in the direction we would want, but I'm curious if you have something more recent than that.
We are working on it. I know that doesn't fully answer your question, but yes, we realize that is outdated and everything. And, after COVID, obviously that also, plays a factor into everything. So we are working on updating that, and I'm happy to follow back up once we have it completed and everything.
Yeah, I appreciate that, and I know it takes time to gather that longitudinal data. Do you have a timeline for when you might have your more updated numbers?
I don't have a definite timeline as of right now, but hoping within, the next few months.
Okay.
So,
yes,
but
would love to see that information
Yes.
when it's prepared, and thank you so much.
Yeah, 100%.
Did you have a couple other talk about services maybe?
Yeah, I would like to point out in your folder, we did prepare a document that talks about the services that are provided in the school-based health centers. So take your time to peruse through that, but some of the things that our students benefit from by having the school-based health centers right there in the school is that elimination of the barriers to access. That's one of the things that we have found that students and parents appreciate the most, is that they, typically if you have to see your physician or see a mental health provider during the school day, the students would often miss a half a day or a full day depending on the parent's ability to, pick them up and take them back to school. So students are able to just miss an hour or maybe two of school by going down and having their primary care or their mental health visit during the school day. Some of the other things that our providers are able to provide during the school day is immunizations. That's something that we have seen with the pandemic, is that so many of our students missed some of their core well visits, and along with that missed some of their school-required immunizations. So that's something that the school-based health centers are able to provide too. They have the full range of school-required immunizations that students can come down with parent consent and receive during the school day. We also really love to get our providers out into the classroom to interact with kids, because we know that students are so much more likely to seek out medical or mental health services if they have a relationship with their provider. So we do try to work with our health teachers and different teachers to have the providers in the classroom, just letting them know, like, hey, we're here, these are the services we provide, come see us anytime. And then I can't remember, someone had asked about the funding. I think it was you, Representative Conlon. That's on this page too at the bottom, the different models, and then that's the base funding that is provided through the department. And on the second page, it talks a little bit more about the mental health only sites that Renee mentioned, that you'll see in different places referred to as E3. So that's just one mental health provider, master's prepared, in a school as well. So.
Thank you. Can you touch on, are you responsible, or is it separate for the vision and hearing screenings that are done?
So our school-based health centers do provide that service. Most school districts in the state, though, partner with their local health departments. They come in, provide the hearing and vision screenings, but for those ages that either aren't scheduled to be screened that year, or if a school employee or a parent has a concern about their specific student, that is available in the school-based health centers to catch some of those kids that maybe weren't screened because of the state mandated screenings, or any follow-up care too.
Thank you.
Yeah.
Any other questions? Thank you so much for your presentation. We appreciate it.
If I could just, sorry,
Sure.
Madam Chair, one more thing. If anybody is interested in touring, my card is in your folder. It's got my cell phone and my email address. Feel free to have your staff reach out. I can let you know what centers are in your district if you have any. If not, there are a few here in Lansing as well. So we're happy to set up a tour in one of our Lansing CAHCs as well, if you wanted to get in and wanted to see one in person, for those of you that haven't gotten a chance to do that already.
Fantastic. Thank you so much. I do want to say a welcome to the Center for Health Research Group. Thank you for being here with us today and meeting with me earlier. And as a reminder to representatives on this committee, we're about to go into our 2-week in-district work period, where we'll all be very diligently at work in district. I would like to remind everyone that as we're away from Lansing for a few weeks, Medicaid Unwind starts April 1st. So uplifting that in your coffee hours and social media. We did receive a toolkit from DIFS and DHHS. Should be in your inbox. If you didn't see it, ask your staff, but I will be uplifting that over the next couple weeks. There being no further business before the committee will stand adjourned.